Now that we have a brief introduction as to what IBD is, and more specifically what Crohn's disease and ulcerative colitis is, let's talk about the signs and symptoms of IBD. So, IBD most frequently occurs in people in their late teens and 20s, and actually men and women are equally affected. IBD is also hereditary. Research suggests that a combination of genetics, environmental factors, and an unbalanced mucosa in the intestines contributes to the development of IBD. Now, the mucosa, just to clarify, is the healthy bacteria that lives in the intestines and contributes to the normal digestion process. Diet and stress may also aggravate the disease. So let's get to the symptoms of Crohn's and UC. I'm going to draw a Venn diagram so we can keep the signs and symptoms in order and also compare and contrast. Now remember to note that the symptoms of both diseases vary in degree depending on the patient. So starting with the middle, some of the shared symptoms of both Crohn's disease and ulcerative colitis are diarrhea and rectal bleeding, an urgent need to move bowels, abdominal cramps and pain, constipation, a loss of appetite, fatigue, and weight loss. Patients with Crohn's disease may also experience fever and anal fissures or tears in the lining of the anus. And over here, in the UC column, patients with UC may feel nausea. Now, since both diseases are chronic, patients can experience flare-ups or symptoms followed by periods of remission. Many times, progression of the disease and increased severity will affect the quality of life for the patient. There is no cure for IBD, and the goal of medical treatment is to achieve remission and then maintain remission. Since symptoms and prognosis vary between patients, there is no standard regimen for treating IBD either. Generally, patients have to see what works for them to control their flare-ups. They generally have to take medications and also work to change their diet and nutritional habits.